I'm Anne Marie Gattari. Welcome to Aging Well in America. Every day, 10,000 people turn 65 years old. 5.5 million people are aged 85 or older. By the year 2050, which isn't that far from now, 20 million people will be aged 85 or older here in the United States. There's a lot of good work going on to get us ready for that, around the country, around the state, and right here in our own community. And I have with us today, in fact, we are at his facility, Dave Gilboe, physical therapist. Thank you, Dave, for joining us and inviting us into your facility.
My pleasure, Henry.
You've got a wonderful facility here that you're going to help us understand how we can prevent falls and help with balance issues as we age and get older. And that's really important to keep us upright, strong, and face our aging process head on.
Right.
Before we get started into that, though, Dave, tell us a little bit about yourself, your background.
I'm a physical therapist, was educated at Wayne State University. I've been a physical therapist for 38 years. I've been in private practice here for the past 36 years.
Okay. So your office, your facility here is in St. Clair Shores.
St. Clair Shores, 9 Mile Mac area.
Right.
Been at the same location, as I said, for 36 years.
36 years. So the first 2 years you were working in hospitals?
Hospitals, nursing homes,
okay.
Home health.
You were really one of the pioneers in having a facility dedicated to this type of work.
We were the first outpatient private practice in southeastern Michigan.
Is that right?
Yes.
Is that right? Tell us a little bit about your practice, how big it is, how many therapists you have, what some of your specialties are.
We have 6 physical therapists, and we see all sorts of musculoskeletal issues. We have an occupational therapist who is a certified hand therapist, and she sees all kinds of hand, wrist, forearm, elbow kind of problems.
Carpal tunnel?
Carpal tunnel, nerve damage in the hands, finger amputations, that sort of thing. Sees all kinds of things like that. Burns.
Okay.
And one of our physical therapists is also an athletic trainer, certified athletic trainer.
Oh, okay.
Another one of our physical therapists is both a physical therapist and an occupational therapist.
Wonderful. Wow. Lot of expertise.
185 years of clinical experience.
Among all of you. How does somebody come to your facility?
Usually people are referred by their physician, or if they come out of a rehab facility, they would come here. Some are just referred by friends and family who have had some experience with physical therapy, and most specifically our office.
Now you take insurances, Medicare of course.
We take Medicare, Blue Cross, HAP, all insurances we accept.
So if a doctor is writing the script for physical therapy, does the doctor often say where they must go, and if they do, can the patient select his or her own?
Patient has the freedom to go anywhere they choose. The doctor can recommend a place, but you as a consumer have the option to go anywhere you think is best for you.
Okay, so if somebody is referred to another facility and they want to come in to Dave Gilboe Physical Therapy, they can request that?
They certainly can.
Okay. They can call you and you'll make the change as well?
Yes. They call for an appointment. Part of the process is we then check their insurance coverage so they know ahead of time what their coverage will be.
Okay.
We set them up for an initial visit where they're given a thorough evaluation, and then we schedule subsequent visits to address whatever problems they might have.
Okay. Tell us a little bit about the trending as our population does get older, as the baby boomers are, entering. That's the 65. What are you seeing? What are some of the trends you're seeing?
Well, one of the good things I'm seeing is that people are staying more active and healthier longer, so that they can participate in sports and social events, family activities much longer, so that they can stay independent in their own homes much longer, pursue their hobbies and interests much longer. So we see that. We also see, though, that because we're living longer, things like balance and falls become a bigger issue for us. We know that balance problems are the #1 cause of falls in this country.
What, before you get into some of the statistics,
Yeah.
what causes somebody to have good balance one day and the next day not?
In the absence of an injury, it doesn't happen one day to the next. It's a very gradual onset. And we gain our balance from our brain, our ears, and their muscles and tendons and joints that tell your brain what's going on in space. Those lose their acuity as we get older.
Just naturally.
Wear and tear. Everybody loses that if you don't address it. If you address it, the loss will not be as fast. You can stop that loss, reverse that loss, and maintain good balance and posture.
You can reverse it
through the lifetime. Yes, very reversible if you train those structures that improve your balance to work.
Tell us a little bit about some of the statistics that you work with.
The statistics are kind of frightening.
Great.
1 out of 3 older adults, and that's over 65, falls every year. Problem is they don't tell anybody about it because they're embarrassed. So the number is probably even higher than that. Among older adults, falls are the leading cause of fatal and non-fatal injuries, more than car accidents, more than anything else. Cost is astronomical. 20 to 30% of people who fall suffer moderate to severe injuries, lacerations, wrist fractures, hip fractures, head injuries. They're the most common cause of traumatic brain injury, falls, and those falls can be in the home, in the community, anywhere.
Outside, getting into a car. Right, right. So we're going to talk about today specifically fall prevention and balance, because they really do go hand in hand.
Yes,
right?
Definitely.
And you're also going to demonstrate some of this for us.
I'll be glad to.
Before we do, are there other, can you give us a list of pointers how to approach this? I mean, obviously physical activity and some type of exercises that you're going to show us are some things we can do, but how do you prepare yourself mentally to...
Let me tell you who's at risk for falls.
Okay.
Older population, obviously. Why? Make sure that the vision is not an issue. We get a lot of feedback to our brain through our eyes. If I have you stand on one foot with your eyes open, you may be able to balance very well. If I then ask you to close your eyes, you may not be able to balance very well. So we're getting visual cues. That helps. Always make sure you have appropriate footwear. That's another big cause of balance issues and falls.
Slippers, right?
Slippers are not good unless they're a full...
Slippers are not good.
The kind without heels and backs are just not good.
They also promote shuffling, don't they?
Yes, and that's one of the things we'll talk about you don't want to do. You would think that people who take short shuffling strides would be safer because their feet are on the ground more. Statistically speaking, we know that people that take longer strides have better balance and fall much less.
Okay.
So vision issues, certainly good footwear. Make sure that you're not over-medicated. Have your physician review your medications, because medications can cause you to feel a little bit dizzy or out of balance. Make sure that you're secure in your footing. Don't move too fast for what you're able to do. No matter how much in a hurry you are, make sure that you can move safely.
So when you stand up, I know my mom used to do this. She would stand up, she would grab her walker and go. You're saying stand?
I'm saying stand for just a moment,
Yep.
get your bearings
Right.
before you go.
And maybe look up and straighten up if you can.
Always got to sit up straight and stand up straight
Sit
because
up.
that's how we were engineered.
That's right.
Yeah.
Let's go over to your some of your exercise equipment and
Okay.
show us what you're talking about.
I'd be glad to.
Okay.
So what I'd like to go over first is the proper way to rise from sitting and then resume sitting.
Okay.
We do it all the time. We do it multiple times a day. We don't think about it. The safest way to do it is for you to spread your legs a little bit apart, pull your feet underneath you a little bit. Now, in order to stand up, you need to bring most of your weight over your feet. So we have to
Right.
bring your head and shoulders forward, and then you come straight up. Great.
Okay.
And you
maybe-
reverse the process when you sit. And it's very important to know
So if
that
I'm
something
down-
is
if-
behind you.
If I'm out here, I got to back up.
You got to back up until you feel the chair against the back of your legs.
Okay.
Then it would be great if you could reach back and touch the chair. Probably the seat would be even better.
Ah.
And then sit.
Okay.
Right? That's the safest way to do it. Never sit unless you feel something behind you that you can sit on.
Right.
Try to avoid rolling stools or rolling chairs. Those are not safe.
So many of our kitchen chairs have wheels on them, right?
Those need to go.
They need to go right off the bat.
Right off the bat, those need to go. Loose carpet needs to go. Throw rugs need to go. All of these are major problems when it comes to falls and balance.
Exactly.
People should have grab bars around their toilets and showers.
So we're talking about some safe things, not just for our parents, but for us, right?
All of us.
Everybody. There's no reason to remodel a bathroom and not put grab bars in
Correct.
there, right? Every hotel has.
No matter how old you are.
Exactly. Exactly. Okay, what else do you have for us?
Again, make sure that you have good vision. If I ask you to stand on one foot, okay, with your eyes open. By the way, anybody 60 and over should be able to stand on each foot by itself for 15 seconds minimum. If you can't do that, you really need to work on improving your balance.
With eyes open.
With eyes open and no support.
Okay.
Okay. Now, you're pretty rock solid.
Yeah, I made it a little difficult, though, because I wore a couple-inch heels,
Okay.
which I shouldn't have done.
High heels are not a good thing if you've got a balance issue.
No.
They're not a good thing anyway for what they do to the alignment. But anyway.
But anyway.
Yeah, we're not going to get into that because I know I'm not going to change your mind. So if you stand on one leg with your eyes open, again, you're pretty rock solid. Now, if I ask you to close your eyes,
yeah,
you feel yourself wavering a little bit.
I sure did.
Okay. That tells you that you get cues from your vision. That's like if you've ever gone to Mammoth Caves and they do this great demonstration, you're in the cave, they flip the switch and the lights go out and you don't know where you are, and it's a very scary thing.
Right.
You're not getting any cues to tell you where you are in your environment. So it's very important that you keep your eyes open and that it's well lit, the area that you're in. That means night lights in the bathrooms, night lights in the kitchens.
So you're not saying, Dave, that we should be able to stand on one foot with our eyes closed. You're just making a point that we need to have.
You need to have an environment that you can see well in.
Okay.
Right.
Okay.
You ought to be able to stand for a period of time with eyes closed on one leg. Not a functional thing, but it's an exercise we do with people to improve their balance.
Okay.
All right.
All right.
But that gets back to, like I was saying, night lights in the bathroom, night lights in the kitchen, night lights in the hallways. We don't want to enter a dark area because we lose a lot of our cueing that tells us where we are in our environment and allows us to make adjustments to our balance.
Okay. All right. Very good. So that's about balance.
One of the exercises we do with people who have balance issues is practice standing on one foot. And many times they can't do it without support. So we'll tell them to go to a kitchen counter, put their hand on the kitchen counter, get set nice and comfortably on one foot, then take the hand away. And you'll feel all the muscles working to keep you balanced. And you do that either side. And you want to, again, go a minimum of 10 seconds, 3 times on each side, and that's a great daily exercise to do.
Maybe in the middle of watching a movie or watching TV.
Watching a movie, chopping vegetables, let's do this.
Ah.
Standing in the bathroom, brushing your teeth, let's do this. Anytime you're standing, if you could take all of your weight on one side and not fall over, that's a balance exercise.
Okay, okay. Tell us why. What's happening when you're standing on one foot?
First of all, you have to get your center of gravity over your base of support. That sounds technical, but it's really not. You're doing this all the time and not thinking about it. So every time you take when you're walking, half of the time you only have one foot on the floor.
Okay.
The other foot is swinging through.
Right.
So you're not doing anything different than this.
Right.
But if you can't do this, it's very difficult then to add forward momentum and keep your balance. So this is kind of the building block, the foundation for you to be able to walk safely.
Okay.
We also want you, when you walk, to make sure you pick your toes up. Too many people catch their toes because they're not paying attention and they get lazy. We get a little bit lazy. So we want to pick our toes up so our toes don't catch on carpet or concrete or whatever. Make sure we get a nice heel strike, and we take even strides at a normal cadence.
Okay.
And that's the safe way to do it.
So how do you, I mean, we tend to sometimes
shuffle as we get older?
Yeah.
Yeah, not good. I mean,
and we do that because we think we're safer, right?
We think we're safer, and we just tend to move less in general. Joints get stiffer, muscles get shorter, and so there's less movement available. The more you challenge your movement, keep your movement the way it is when you're younger. As much movement as you had when you're younger, the better you're going to be. Because the more time you shift weight, the better you get at shifting weight. And that's all balance is maintaining an upright position as you shift weight.
Okay. Show us some other exercises here that might help with that.
One of the things we have people do is to push off. Take my back foot and I push off to go forward. You do that every time you take a step. You don't think about it. If you don't push off, you start to walk flat-footed, and you lose all the input coming up through your leg to your brain to tell you what's going on. And it's a much more dangerous way to walk. So we encourage people and we train people to use a push-off when they step forward.
So earlier you had said that you can retrain yourself.
Yes. If you do these type of exercises, all the sensors that tell your brain what's going on will improve, and your balance will improve, which minimizes your fall risk, which minimizes your risk of severe injury.
Why
Also,
not?
I have to tell you something important.
Yeah, please do.
If you need an assistive device, you should use an assistive device. Don't let vanity cause you to injure yourself because you don't want to use a cane or you don't want to use a walker. The reason for using those devices is multifocal. First of all, if you use a cane, you've got a third leg, right? You can disperse your weight over three, like a tripod that a camera sits on. Much more stable environment. Also, if you're in a crowd, that cane acts as a red flag so people don't knock you over or bump into you. Also, if you have difficulty walking and you add an assistive device, it's an energy-saving device. It's much easier to walk longer distance if you use a device when you need one than if you try and struggle through without.
Canes also come in sizes and shapes, and
when you buy a cane, you need to
important.
buy an adjustable height cane. Fancy wooden ones are really nice, but you may not be able to get them just right. So we always encourage adjustable height aluminum canes. We encourage straight canes because if you use a 3 or 4 prong cane, the only time that's really stable is when there's an equal amount of weight on each of those prongs.
Right.
And that's not very often.
right.
Whereas if I have a straight cane, I can angle it any way and I still get good contact with that rubber foot at the bottom so that I get good support that's not going to slip on me.
When do you know you need a walker versus a cane?
Walker usually, when you need more than just another, one more support, the walker really helps people who, especially people who have a tendency to fall backward. If you give them a walker, that leans them a little bit forward so they don't tend to fall backward. Also, people that have a fatigue issue, walker again is an energy-saving device, another step up from a cane. Okay. So if you find you get fatigued walking with a cane, you need to start using a walker. And a walker is no more than a grocery cart.
That's right.
It's the same thing.
That's right.
So if you feel pretty good when you're using a grocery cart, but not so good when you're not, you probably need a cane or a walker.
Yeah, that's a that's a good little test, isn't it?
It is.
Yeah. Okay. Show us some other things.
Okay.
What's a proper way to go up and down stairs?
Up and down stairs. First of all, everybody should have a stair rail. Minimum of one stair rail on one side or the other. And when you go up, if you have a limb that's better than another one, you should always initiate the step up with the good limb. Okay?
Okay.
Because it's going to take most of the weight, it's going to do most of the work. So we say the good leg leads going up the stairs. And then this one can come. As long as you can do it, it's much better for you to alternate on stairs. But that involves a lot of weight shifts, side to side, forward and back. Whenever we move, our pelvis goes like this, it goes like this, and it goes like this. So all those things happen when you alternately shift weight and shift height like that. If you have a difficult time doing that, there's nothing wrong with one stepping it at a time.
Okay.
The key here is safety. That's what we're all after.
Right.
Safety and being able to do the things that you want to do.
Right.
Coming down, it's exactly the opposite. You go down with, if you have a leg that's involved or injured or whatever, always come down with that leg because then your good leg will take the brunt of the force and do most of the work.
Okay. When do you recommend people to just lock off the basement and forget about using those steps?
I try not to. As long as you're safe and comfortable and confident on stairs, we encourage you to do that. But again, part of that is having a rail. Part of that is doing it correctly. Part of it is taking your time. If you have a balance issue and you need to hang on and you want to do the laundry, you get a backpack, you throw your laundry in the backpack, put it on your back, go up and down the stairs.
Yeah,
Same thing coming up.
Don't do this.
Don't have two hands occupied when one of them should be on a handrail.
Got it.
Okay.
Okay. All right. Very good. Balance and fall prevention. So I'm sure you've got some success stories you can tell us
Yes,
about.
one of the most interesting ones was a 65-year-old tennis player, high-level tennis player. He was going to have a knee replacement. We wanted to see him before he had the knee replacement to let him know what was going to go on and to kind of get him in shape for that. So one of the things we do with all of our patients is test their balance. Well, on his bad knee that he was going to have replaced, he had no balance. He could stand on his other leg all day long. He couldn't last 3 seconds on his involved knee. Why? Because there was damage to that joint.
Sure.
He was losing feedback so that he couldn't adjust because he didn't have any feedback. You know, your brain senses what's going on down here.
Yeah.
That message comes up here. Your brain processes it, sends information down there.
Yeah.
He got angry with me. He thought I was tricking him. How come he couldn't stand on that leg when he could stand on the other leg? And he's a high-level competitive tennis player.
Right.
So I'm not tricking you. I didn't do anything different on that side than the other side. That tells you how bad your knee is and probably had been going on for a long time. Once he had his knee replacement, we really worked a lot on balance, which we did even before the surgery, and he much better and went back to playing tennis.
You just really raised a great point about coming to see you before surgery.
Yes, because there are things you can do prior to surgery to maximize your outcome of the surgery. First of all, just knowing what to expect. A lot of times physicians are kind of busy, they don't have the time or take the time to tell people the details about what to expect.
Yeah.
And that eases people's concerns and worries. Second thing is we can get people doing exercises to improve their current level of function so that they're even better prepared for the surgery physically.
Excellent, excellent. Let's talk a little bit about posture.
Okay.
Because that's all related, right? To
Definitely,
balance and fall prevention.
Right.
So we tend to see, I just came back from visiting my 68-year-old brother. He looks so much like our dad, who passed away at 90 a few years ago, and he was even walking like him and shuffling. And I said, Tom, you need to go to a physical therapist. Don't do that. Try straightening up. And when he did, and he knew the exercise to do, stretch his back against a wall, but it did pain him.
That might be a result of some arthritic problems that he's developed in his back. It would have been great to see him a few years before that might have developed. But we all tend to bend forward a little bit as we age. And before that becomes a structural problem, if you're aware of it, you can get back to a neutral position.
Arthritis is his issue. So how do you work with
Well, you try and get him to strengthen all the things in the back of his body, in the back of his trunk and core, because they've been stretched out and weakened. So now we want to strengthen those and stretch these. So he can get up there as far as his arthritis will allow.
So with arthritis, you can still strengthen and prevent and even restore, regain?
You can certainly prevent any progression, and in most cases, you can regain a lot of that mobility.
Why not go to just go to a gym, sign up at?
You can go to a gym eventually, but you know, we really firmly believe, and the literature shows, that you need a professional to really analyze things. We need to analyze your strength, we need to analyze your range of motion, we need to analyze your balance, we need to analyze your function. You know, what are you doing now compared to what you want or need to be able to do? And then we can direct you and we can treat you, but also more importantly, we can educate you about what you can do to maximize your functional ability. Then you can go to the gym and do it.
Yeah.
But it's not a good idea to just kind of haphazardly do things. You know, we always say it's not practice makes perfect, it's perfect practice that makes perfect.
Oh, that's a good one. We also have a lot of, in our gyms, more and more personal trainers who are excellent at what they do, but they are not physical therapists.
Correct. They're an adjunct, they're an enhancement, certainly, because we do a lot of education and we send you home with a lot of homework. So they can help you with that and make sure that you're doing it right. But we really feel that physical therapists are the professional to help guide you and get you through that.
Do you work with trainers?
Yes, we work with many times. If we have patients that come in who are using a personal trainer, we encourage the trainer to come in to see what we're doing, so then they can enhance what we're doing when the people are in the gym.
Excellent, excellent. Dave, you do wonderful work here. Your facility is fabulous. You've been here for a long time. I know you've helped probably thousands of people throughout the years. What else? What else would you like to tell us before we wrap up?
You can go anywhere you want. We talked about that. Don't accept the fact that you've had pain for a long time. Well, this is just my lot in life. It's not. You can usually change it. Don't accept the fact that your balance is deteriorating a little bit, thinking, well, this is just my mom was like this, my dad was like this, I can't do anything. We know so much more now than we have in the past. You can change things for the better with some effort.
So it's possible to get a script from a doctor.
Yes.
Whether or not you've had it, it doesn't necessarily have to come after an event, after a fall, after surgery.
No.
If you're having pain, if you're feeling that you're walking in a way that you're not happy with, you can.
I would like to have my posture evaluated. I would like to have my balance evaluated. I would like to have my biomechanics to improve my sport evaluated. Maybe there are some things I can do to improve my sport performance, but you need a professional to look at that and tell you where you're lacking and what you can improve and how to improve it safely.
So the patient, your client, would go to his or her doctor, get a script, and then bring it to you?
Yes,
or
that's
call
the
you?
usual state of affairs. Or if they don't have a physician that they normally use, they can call us. We can help direct them.
Okay. But it typically comes to you in the form of a prescription?
Yes.
Okay. Very good. Thank you so much. What a wonderful
My pleasure.
show. You really have a lot to offer.
Hopefully we can spread the good word.
Yes, absolutely. Absolutely. Well, thank you for joining us for another episode of Aging Well in America. And if you follow Dave's advice, you certainly will age well. As always, please send us your ideas for future shows, future programs at the Grosse Pointe War Memorial. Thank you again. We'll see you next time.